Hello, and welcome to another episode of Ask Kate, brought to you by the Children's Tumor Foundation. I'm Kate, and I am very excited to be here with you again. It's been a little while, we've been on break, and we're happy to get started again. We're going to call this Ask Kate Season 2, and we're going to focus a series of episodes on different topics as they relate to living within the NF community. So this first part is going to focus on NF2. We're going to devote at least 4 episodes to different aspects of living with NF2 or caring for someone who has NF2. And we're going to go through some different topics. I love hearing from the community, so I hope that you'll be interactive either by leaving comments down below, or you'll see my email address at the bottom of the screen, and I would love to hear from you. Especially if you have ideas for future topics, I am all ears and I'd love to hear them. So to get started today, I wanted to talk a little bit about some of the struggle and the complications that can come up when we're looking for a diagnosis with NF2. This is often the very first thing that needs to happen in order for someone to get connected to the best level of care. They need an appropriate diagnosis. And unfortunately, more with NF2 than in the case with NF1, we see difficulty getting to that diagnosis. So the way that I'm going to do that actually is that I reached out to some people within our NF2 community and I asked them to share their story of diagnosis with me. Now, I've taken names and identifying information out, but I'm going to share just a couple of those stories today with you to help highlight what some of those difficulties can be when it comes to wanting to get that diagnosis. So we're going to start first with the story of a young woman who was formally diagnosed with NF type 2 when she was 24. Her story, however, goes back much farther than that. When she was 7 years old, she had a small tumor removed from one of her ankles, but there was really not any follow-up given to that. It was said that it was benign and that it was not anything to be concerned about, and she went on with her life, and her parents went on with theirs, and there was really nothing for anyone to worry about. Several years later, in her mid-teens, she developed a large tumor on her left foot. So in the area where your foot arches underneath, something was developing there that was giving her a lot of pain and discomfort. She was continually referred fairly inappropriately by her family physician to physical therapy, to a chiropractor, to podiatry, which is a foot doctor. And most of these people just really wanted to give her a special insert, something to put in her shoe to deal with whatever this strange pain that she was experiencing might have been. This went on for several years. It discouraged her from participating in sports and other forms of physical activity because she had a significant amount of pain in that particular foot. Finally, at the age of 23, she had a physician refer her for an MRI. So we're talking from around 14 all the way till 23. So this is 9 years of pain before somebody says, let's take a look at that foot and see what might be going on. So they get the MRI and they see that there is in fact a nerve sheath, what they were calling a nerve sheath tumor in her foot. So that was finally the thing that set her off in the direction of getting a diagnosis. Initially, they talked about possibly NF1, and she was referred to a neurosurgeon with some experience in this area, who then did the differential diagnosis between NF1, NF2, or possibly even schwannomatosis, which is another part of the NF family. He ordered a brain MRI, and that MRI revealed bilateral vestibular schwannomas. So if you're already familiar with NF2, you probably know, so then she got her NF2 diagnosis. The reason for that is because the vestibular schwannomas are benign tumors that grow on the nerve that contributes or is in charge of both hearing and balance. And we see this in NF2. It's sort of a hallmark sign of the condition. So these tumors, while being benign, can grow over time and disrupt the ability to hear as well as balance, which can be very difficult in terms of mobility and function. So when those tumors were seen, she was officially given the NF2 diagnosis, which then helped her to get in to see physicians who have experience specifically with NF2, which was certainly helpful. However, if we think through that timeline, she really had her first strange symptom at the age of 7, and she was not given a diagnosis of NF2 until she was 24. Now, no one is faulting a pediatrician or a family physician who sees a 7-year-old with a benign tumor in her ankle and doesn't think NF2. That's probably never going to happen. In fact, we're going to talk about a story in a few minutes where we hear a little bit more about how a childhood diagnosis of NF2 is made. because in the vast majority of cases, NF2 is diagnosed in early adulthood. There are lots of exceptions to this, and you may be one, but that is still statistically the most common time when the symptoms tend to come up. And it usually starts with tinnitus, which is ringing in the ears, problems with balance, or changes in hearing. So for this particular young woman, those were not any of her initial symptoms. And so already we've got many, many years to diagnosis, and we have presenting with the wrong symptoms, right? Not the hallmark, not the things that would make someone go, oh, we might be needing to think about NF2. So I asked this particular young woman, how was this experience for you? And really, she explained that it was frustrating, particularly when she had this tumor growing underneath her foot and nobody was taking a serious look at that. And nobody was saying, why are you having so much pain? They were calling it plantar fasciitis for years, which is a completely different chronic condition that lots of people have that usually resolves with the appropriate physical therapy. So it was frustrating for her to feel like she wasn't being listened to. And that might be an experience that you have also had. And so that is one reason that it's very important to the Children's Tumor Foundation that we, advocate, educate, and make sure people are just aware of these conditions, particularly physicians, doctors who are seeing these patients and who might, because of work that we're doing as a community, including all of you, who might start to think, oh, I wonder if something else could be going on here. This young woman did eventually have genetic testing that can further confirm the NF2 diagnosis. But as many of you may know, genetic testing for NF2 is not always, it's not that it's unreliable, it's that it's tricky, it's complicated. It's one reason that we highly recommend that if there is a consideration, if a doctor is talking to you about whether you might have NF2, seeing a genetic counselor, a medical genetics physician is an absolutely important step. They understand better than anyone how this works, what the testing means, what it can tell you, what it cannot tell you. So that's always a very important piece of advice that I like to make sure people hear repeatedly from me. The next story I want to share is actually just really different, which I think helps to highlight the difficulty with getting to diagnosis with NF2. So this is about a young boy, a little boy that when he was born, he had multiple complications that all seemed to have to do with his eyes. Without getting into the details of these kind of complex issues that he was having, I will say that, for example, he had a cataract in one of his eyes, and then he had a pretty serious abnormality in his other eye, that caused a retinal detachment, which essentially can lead to full blindness. And so for this family, the first several years of their son's life was devoted to trying to save and preserve whatever vision they could. And there really was never any conversation with the family as to why this was happening. It was just considered, he was just born with these things, and we need to address them. He did end up losing vision in one eye, but preserving and saving vision in the other eye. And so mom also noticed when he was born that he had 2 small spots on his back that the pediatrician said, oh, these are just, moles. We don't need to worry too much about these. And again, there was a really heavy focus, appropriately, on saving his vision, which a lot of times can sort of shadow other things that might be going on. And that's not uncommon. So when he was around, 5, Mom thought that maybe one of these spots on his back had grown. Things with his eyes seemed to have settled down a little bit. Life seemed a little more stable. She noticed that one of these supposed moles on his back seemed larger. They got in to see a dermatologist who did a biopsy, and the first thing they called it was a plexiform neurofibroma, which is interesting. And Mom actually, in sharing the story with me, it sort of highlighted to her. She was like, oh, that's interesting because that's a common type of tumor that we see in NF type 1 and not commonly in NF2. So at first that was the conversation. And so Mom spent some time doing a lot of research and Googling and finding a lot out about NF1, which is more common in terms of a childhood diagnosis. It's also just more common statistically across the world. However, she did eventually have her son seen at a children's hospital that's in their region, and there was genetic testing done. And in their case, the genetic testing did reveal that he had NF type 2. And again, that's not always the case. However, it was certainly incredibly helpful for this family because now that they had that diagnosis, they knew what testing needed to be done. They got in to see a specialist who is an expert in NF2. They have a lot of his care done close to home, but they still speak with and work and communicate with a specialist who's quite a bit farther away. That's quite common for NF2 patients, is that because the number of people who are really who are seeing a lot of people with NF2 and have a lot of experience with it, the number of doctors that meet those criteria are fairly low. And so many patients will have their primary care done locally to them, but have those doctors in communication with a physician who's a bit farther away and has a bit more experience. That's fairly common. He, since diagnosis, was diagnosed with bilateral vestibular schwannomas. So again, those tumors on each side of the nerve that controls hearing and balance, those are being watched. He's had multiple surgeries to remove other types of tumors that have come up. And overall, they feel like at this point, he's 11 now, that he's doing well, that the NF2 is fairly stable, and that while it was a very trying and difficult journey, that they are glad to be where they're at now, involved with CTF and in the care of experienced physicians. So I just wanted to highlight again. So we have these two stories with two individuals with the same diagnosis at the end of the day, but who got there on vastly different roads. One thing to keep in mind is that we do know that a lot of times with children who get a pediatric or a childhood diagnosis of NF2, their earliest signs and symptoms of that tend to be complications with their eyes, interestingly. So that's another piece of information, that the more that we can make sure people are aware of that, maybe the faster we can get these kids to an appropriate diagnosis. And the biggest reason for that really is to get into the highest level of care that you can. So once you know what your diagnosis is, then you know what kind of physicians you need to see, what kind of testing is going to be important, how to follow this individual over the years. So that's really important. So you probably, if you're involved with the NF2 community, have heard that there's been a lot of talk about changing the name of NF2 and about updating the diagnostic criteria. This is still in progress. There are some issues with the way we make diagnosis that a team of experts is really trying hard to address. So stay tuned for more information about that for sure. So this was our first episode of Ask Kate Season 2, focusing entirely for the next several episodes on NF2. So if you have specific questions about anything I said today, or if you have questions or an idea for a topic in the future, whether it's NF2 related or not, please leave a comment, please interact. I love to see you guys and know that you're watching. You can also, of course, always just email me directly. I am here for you. Have a wonderful day.